Okay, hi everyone. Welcome back to the Coach Rob channel or Facebook page. And in this series, I like to talk to entrepreneurs where they share their story and how they began so we can inspire other entrepreneurs. And I also like to share stories of inspiration. So today we have with us Michael Deakin, the president CEO,
President, CEO, founder,
driver,
driver.
delivery of Lifeline. Michael, hi, welcome,
Hi,
and thanks for doing this interview.
you're most welcome.
I was telling my wife, I don't care where we live, as long as there's a lifeline. You know,
Uh,
you guys,
Thank
you
you.
guys really give me comfort, and it's nice to know that you guys are around. Just a little overview. Lifeline. You guys have been around for 25 years,
Yes.
and based on the article that you gave me, you guys have saved 250,000 lives so far. Well, what's the
Yes.
update?
On the lives saved,
Yeah.
maybe the last 3 years has been the biggest jumps in lives saved. So I remember starting in Lifeline 20 years ago. We
Yeah.
saved 565 lives for the year.
For the year.
Yeah. Last year we did 18,891 lives.
Holy moly.
So I think we're getting
Wow.
better at it.
Yeah, you have your key to heaven right there, buddy. So you have 400 professionals with you.
400
Is that
professionals.
the EMT, the emergency medical guys?
They're a mix. Right now, we mix it between all drivers are EMTs. They're emergency
Yeah.
medical technicians, and on board there are EMTs and registered nurses. In select ambulances, what we call the first to runs, there are doctors also on board.
Okay, and you have about 60 ambulances now.
65 ambulances and first responders.
Okay. Now, the reason why I wanted to talk to you is because I was doing a seminar. Then you were outside. We're having a chat outside the training centers for
Mm.
for your guys, right? And then I asked my favorite question. Tell me how you started. No, tell me your story. And you told me a story that I didn't expect. So I'm gonna ask you the same question now. If you can share with everyone, can you
Okay.
tell us your story?
Well, my background is hotel and restaurant management. So I finished, I'm Filipino. I migrated to Australia when I was 16, finished school in Australia, joined the hotels right away. My ambition, my dream was to be hotelier, GM. Uh, Targeted 10 years to make that. Got it. So I was 29 when I got GM of a hotel. Uh, Met my wife, Monica, got engaged and thought everything was great. This is a great future. And life took a left turn, and all of a sudden I was approached to basically come in and try to make a company what was called a good concept but a dog of a company. It was losing money, and basically given 12 months to either turn it around or close it down. My thing was and I don't have anything to do with the medical profession, but when I came in and looked at Lifeline, it was set up great by the doctors who founded the company. But what was fundamentally wrong with it, and it's still 20 years later wrong with the system in the Philippines, they lack the service. So in most countries, hoteliers are now starting to run the operations of hospitals precisely to lift up that service standard. If you think about it, it's the same thing. One is for leisure, the other one is for health. But it's the same food and beverage, rooms, turnovers, all of that. So when I came in and looked at it, everything was talking about money up front. And in hotels and in restaurants, we don't do that. You come to my restaurant, you come to my hotel, I welcome you with open arms. I give you everything you want to eat, everything you want to drink, the room that you want, in the hope that I've done my job and you'll pay me in the end. In the hospital industry, it works the other way around. You put deposits down, you find the cash, you get in, you keep paying along the way. And when you're starting a company like an emergency rescue service where you don't know who the people are, they're total strangers calling you up, asking and begging for help, and you're asking for money before you go in service, that was just wrong. So I took a chance and reversed the model. and I came up with this policy of no cash to be taken on board the ambulance and no payments to be given until after the rescue, after the person is in the hospital. Our risk, if the person dies, the person dies, you know. But that changed the entire business model around. And then we did a turnaround for Lifeline that's been around now for 25 years.
I, you know, I'm a bit speechless because it's amazing that we don't even have this as a regular service from the government or for every city. It's amazing that before you guys, I would just see like old Hiaces, you know, driving around, makeshift ambulances. And honestly, yours was the first real ambulance that I remember seeing, you know, the Lifeline guys.
Well, you know, the word ambulance is a French word. It's not an English word. It's a French word that translated means walking hospital. It was
Yeah.
created by Napoleon. Another school of thought, it was created by the Queen of Spain, all in the same time period, where they realized that more people were dying after the battle, not during a battle.
Okay.
So Napoleon, his chief medical officer, I can't pronounce his name, came up with a system of delivering the health care to the battlefield and to save the soldiers from basically minor wounds that they would die of infection. And by treating them on site, it reduced the mortality. And that's how EMS, as we know it today, evolved. You know, and it evolves every 10 or 15 years. The protocols change and change to become updated. The last big change we had, for instance, was in 2010, where everything we knew about the basics, which is airway, breathing, circulation, changed from circulation, breathing, and airway. You know, so it became this system of adapting, and we adapt everything, unfortunately, because of disaster or war. You know, so the EMS was started by Napoleon. It was perfected in every war since then. The first time there was a medical air evacuation was in Korea during the Korean War. You know, so these are all of these things that we need to update constantly. The word ambulance, you know, if you take it literally, means walking hospital.
Yeah.
Therefore, everything that you have in a hospital should be on board the unit, or everything you should have in an ER, emergency room, should be on board the unit. You're bringing it to the patient, to the site, and treating on site, stabilizing and transporting. In the Philippines, there was no law that required the use of the word ambulance. So it took Lifeline almost 15 years lobbying the DOH to come up with the definitions, the terms of references on how to use the word ambulance.
15
And
years.
that only came up 3 years ago, where the DOH now issues a license to have the word ambulance. Enforcement is a very different issue.
Man, yeah, we'll get to that later. I wanted to go to the early days of Lifeline, though. Could you share with us like some of the early challenges that you had to overcome, just to inspire entrepreneurs that think that, you know, sometimes when they see a business, they just see it when after it hits momentum or when it's gotten big, no? But you know, what was it like in the early days?
Oh, it's like the old saying, it took me 20 years to be an overnight success, right?
Yeah.
The early days in any business is the toughest. Most businesses, as we know, will fail in the first year. The 90% will not even last the 5-year mark. For entrepreneurs, if you believe in what you're doing, don't listen to anybody else, because they will tell you everything that's negative. They will tell you everything that's wrong. I always had this position of, what made you the expert? Just because you're a professor in economics or you're a professor in business administration, what made you the expert in what I know and I feel I'm doing is right? And yes, there are mistakes that will be made, but I guess the trick with being an entrepreneur is how far you're willing to gamble on your vision and in your mission. And if you really believe in it, don't quit and don't listen. Just do.
Yeah, but although you say don't quit and don't listen, one of the most common questions I get is, do you ever feel like quitting? And how do you get past that? And how do you get past the struggles and the challenges?
Uh, if you don't go through a day where you want to call it quits, you're not doing your job. The hardest is twice a month. That's the hardest. Every time payroll comes around.
Payday. Payday.
Payday.
Yeah. My God, I can't imagine.
Yeah, it used to be happy for everybody, except for the one who's trying to get the bills paid.
Yeah.
So,
No, and speaking of that, no, you came up with some innovative models, which was memberships with the villages, subscription fees. You know, when did that come in?
the membership was always part of the Lifeline philosophy, using the insurance model.
Okay.
The flaw in the membership model was, one, the price was way too high for what the service was. In 1995, we were charging somewhere in the vicinity of 5,000. We had flirted with a 10,000 peso a year membership for a service that would only cost you 5,000 to get to the hospital at that time.
Mm.
My belief was you bring down the membership. The membership is designed basically to try to cover cost, similar to that of a private club, country club, golf club, etc. You establish you need 5,000 members. Every 5,000 members will put in so much a month, and that will give you your operating costs. So I applied the club, the hotel and club system into the Lifeline membership philosophy and dropped the price down significantly. So from a high of 10,000 in 1995, we dropped it down to 700 pesos. And then it started to bite, started to take off. The issue when it came down to non-members, which was the bulk of our business in the early days, it was a no payment policy on board the units. We just service first. The other one was don't itemize everything on board the ambulance. Don't force the cost cutting at that level, because it'll force the EMTs, the medics, the nurses to start to second guess. They might be in trouble. They might use the wrong thing. Just throw everything in, throw everything at it. And then just live up to your service philosophy, which is deliver it. You know, like, it sounds very stupid, Robert, but when I looked at Lifeline, it was an ambulance company with fully loaded ambulances, doctors, nurses, and EMTs. It's no different to a pizza delivery company that delivers pizza, that cooks it from scratch, takes a call, cooks it from scratch, and delivers it to your house within 30 minutes. If Pizza Hut could do it, why the hell couldn't Lifeline do it? And why are we even negotiating this? It's just a matter of who you put on board, but it's the same exact service system. So all we did was look at it that way.
Yeah.
You know?
You know, yeah, looking at your background, right, I go, well, how did you go from hotel to this? And now I see it, because it's really a service. I mean, you're not the doctor, right? You're not the doctor.
No.
You know, you're just the service and operations, and you put it all together.
I think the benefit, and applies to many entrepreneurs, you don't have to be an expert in what you want or what you believe. You're filling a gap. I think that if I was a doctor, or if I was trained when I started Lifeline, it would have folded within the first 12 months. And the reason for that is the sheer fear of what we actually do on board the unit. There has to be somebody that has takes a back step and looks at the overall picture.
Yeah.
In my case, it was the delivery and the service standard at the fastest possible time, at the highest possible standard. In hotels, I was in food and beverage. I opened many restaurants. I opened many hotels and resorts, but I don't cook. Ask my wife. I burn rice. But
No, I
then
was
I can
also
open a
going to say,
restaurant.
so that's probably why your Lifeline colors are the same as Domino's, no?
Yeah.
Right?
Yeah, they copied us.
Okay, so from being asked to save the company, now you own it. How did that happen?
There's a difference between investors and entrepreneurs.
Mm.
Investors want a return, obviously, a fast return, highest return. So they don't have, and entrepreneurs will learn this if they learn this very young, they'll go a long way. Patience with investors run out very quickly. So as an entrepreneur, your best bet is to try to do it by yourself for as long as you possibly can, without selling, without finding the partners, because the agenda becomes different.
Yeah.
You know, just to backtrack a little bit, Robert, when you talked about the membership, um, the innovations we made. One of the biggest challenges is when we're selling an individual membership, to get critical mass takes a long time, a lot of money in advertising and all that. When the previous owners didn't like the concept of the length of time it would take, I developed what's called a safety zone and said, let's get the largest number of people covered by an ambulance service that's international standards at the lowest price and have only one person pay for that. So we did that by going to the cities. We did that by going to the private villages.
Yeah.
So our first village was Bel Air. Second was Ayala Alabang. And we went straight to the homeowners association and to the barangay captains. After that, we went to the roads and we said to the developers of the skyway and the highways, put us in, pay us this price, we'll cover everybody. No questions asked, at the best and highest standards, at the lowest possible price. That jumped our membership from literally 3,000 people, who we now cover 5.5 million people.
Amazing. And it's funny, you're the standard, you're the Colgate, you know?
Yeah.
When you're the Colgate, like Lifeline, you know, when something happens, where's Lifeline? You know, I mean, they should be here. You know, people expect you guys to be everywhere.
Right.
No, I mean, that's a...
It is very expensive to maintain a 24-hour crew who just sit there with hours and hours of boredom followed by minutes of sheer terror.
Gotta be quick.
And you've got to multiply that in multiple addresses and locations to get to the fastest, to get to the emergency at the fastest possible time.
Yeah.
That's the one that takes a long time, and that's the one that costs a lot of money. As soon as you cost cut on that, people start to die.
Yeah. And you actually didn't have enough trained people, right? You had to start training them yourself. So here I have this service, I don't have enough people, so you put up something else to start training the, what's the term? Medical,
EMT.
Emergency medical
technician.
Yeah.
That's a universal term.
Yeah.
The EMTs came in with an Irishman, a very good trainer. In 1998, he came in, and he was trying to introduce the system into the Philippines. It took a long time. When we tied up with Lifeline and we pushed this EMT system, that is still not covered under Philippine law.
Yeah.
So that's the reason why we double certify. We have registered nurses who we train to become emergency medical technicians. We've trained jeepney drivers to become emergency medical technicians who now work in Dubai, and some of them work in Europe, driving ambulances and serving as EMTs overseas.
Wow.
The importance there is to follow the international standards. In the US, the EMT is more of a pack and go service in the ambulance business, right? Primarily, the rescues and the paramedics work for the fire or the police brigade. The ambulance is a transport. However, in Europe, it's a completely different system where they literally bring the emergency room with doctors and everything to the roadside, to the home. So we use both systems and we combined it in the Philippines under one course. It takes about 2 months, and the certification and administration is done via Australia. So we're always going to be one step away from the accreditation process. This helps in the clarity and the transparency in the way we train. The training is intense. It's 2 months intense in the classroom and another 2 months on the job. That's just to become a basic. And then over the years, it'll take up to 4 years if you do it on the job to become a paramedic. And that changes a lot of the scope of work that you can do and intervene during an emergency.
You single-handedly practically created a whole industry, no?
Yes, and we created a standard for it. And
yeah.
You know, where I lost all my hair was in the expense to maintain that standard. It's easy in the Philippines, you know, and for entrepreneurs to start off with a good vision, start off with the right idea, and then start to downgrade it because of profits or high costs and all that. And I encourage every entrepreneur that gets into business, don't. The market will adapt. If you're doing the right thing, the market will adapt to it. If you're not, and if you're just trying to make a quick buck, it's very obvious. And you will. You'll make a quick buck here, it'll close, open another one, so on and so forth. But if you're wanting to make a difference, don't compromise on your quality and integrity. The public deserve more.
And that leads to when you are going through those down times and the hard times, and you just you don't even think about giving it, just get through it, right?
Get through it.
It's a question, I mean, I have my answer, but it's a question that people keep coming up with to ask me, how do you get through the down times? And it's a strange question for me because you just get through it, right? But do you have any insights on how to get through those tough times?
Well, prayer helps. A lot of prayers. If you believe in what you're doing, the tough times you can convert to opportunity.
Yeah.
Like now, COVID, it's a very tough time for many businesses. But in this lockdown, a strong entrepreneur will be coming up with many different ways and plans to which to innovate and come up with a new normal. And the same thing when things are going well. If you sit on your laurels and just become complacent, it will stagnate and eventually falter and fail. You always have to look at what's over the horizon. What's the customer want? What's the customer need? The customer is not always right, but the customer is always first.
Love it. Mike, the number one emergencies that you used to handle, because you just told me it's spiked, right, in the last 3 years, no?
Yes.
But before that, what were the top reasons why you guys were being called?
Our bread and butter is always the heart attacks and the strokes. That's a regular. That's out of 120 runs a day, the vast majority will be. That has to do with circulation. So lifestyle, bad habits, all of that, stress. So that's the number one. And then you're followed by obviously the lifestyle illnesses like diabetes. And when you look at emergencies, there are two ways of looking at it. And we're in that category, Robert, unfortunately. When you're 40 upwards, it's more illness that will affect us. So now we're talking about coming into the strokes, the diabetes, the heart attacks, hypertension, etc. For the young, from the times when you're about 16, 18 to about 30, that's the highest rate of trauma. These are the accidents. These are the falls, the breaks, the car accidents. These are the ones that need just as fast a response time. Usually involves a lot of screaming and a lot of mess.
Blood.
A lot of blood. But those are the two major anchors when it comes to EMS. Because everything else in between has got time. If you're pregnant, you've got time to get to the hospital, unless you get into a situation where it's coming right now. Then you call Lifeline, we come in. So in that regards, it's divided up. So it covers a wide range. A lot of people tell me, oh, you only handle the elderly. No, the elderly are actually a very small part of what we do. It's all ages, and trauma on the roads in the workplace has been spiking in the last few years, especially with the BPOs. So there's been a lot of trauma, a lot of drugs, a lot of abuse. Suicides is also on the uptake in the last few years. That is always very, very sad and disheartening. We always hope to catch them before it is successful. But on the many occasions we get there and it's all over. Michael,
the trauma is for the kids. Is it motorcycles, scooters? What should the kids watch? What's the most common things so people know and they should watch out for?
Okay, well, when I started for trauma, when I started in 2000, accidents were the sixth leading cause of death and morbidity in the Philippines.
Okay.
Over the last 10 years, that's gone to number 4, bordering number 3, top cause of morbidity and death. And that's primarily due to motorcycles. These,
Motorcycles, yeah.
these cheap scooters that come in.
Yeah.
And it's very sad, when we pick up,
Wow.
obviously a hardworking
Yeah.
young man working in an office. He's just got this cheap ass scooter with this fake helmet, and we pick him up, and unfortunately, he survived the accident. I say unfortunately because now the damage is so severe that he's become uh, paralyzed or a vegetable. And now we're burdened not only to to himself, his family, and the community, all because of one stupid mistake. There are no rules. They're not enforced. They're all over the place. If you've
Yeah.
noticed when you're driving, they're left, right,
Yeah.
front, back. Anything happens, you sneeze, you're gonna hit one of them.
No, it's like water around the car. It's got a
Yeah,
flow. It's a flow, and yeah, it's the
it's
sing it,
dangerous.
the sing it mentality.
Yeah,
If they're just following, if you were to advise someone who rides a scooter, what would be the number one advice that you would have for them to avoid so they don't end up unfortunate?
don't do what they do to sing it, the overtaking.
Yeah, yeah,
It looks easy. Anywhere else in the world that's following proper uh, road rules on motorcycles, you're treating it like a car. You're behind. You can't just overtake for the sake of it. You
yeah,
overtake in a proper lane. As soon as you start doing it the way we do it in the Philippines, it's against the
yeah,
law in many countries, except here. I'm sure
yeah.
it's against the law. It's just not enforced. You know,
Yeah. And it's amazing to me how they don't realize that they're in blind spots of buses. They
yeah.
who
We
normally hits
we
these
had
people?
one
Is it?
we
Yeah,
we had really one sad case, and out of the thousands that we do in a year, there are about maybe a dozen that will stick with me, from the daily reports. And this one case, of in a motorcycle, here was a vendor sitting in on the sidewalk. He wasn't off the sidewalk. He was on the sidewalk. He had put his blanket down, and he was selling his wares on the side of the road. There was a motorcyclist who was driving and overtook on the right side, closest to the banqueta where the guy was
yeah.
sitting. Shouldn't really be a problem, except that he took off his helmet and he put it around his elbow. You know how they carry that? And was
Yeah.
driving. That helmet hit the vendor in the head while he was unpacking his wares. You know, that guy is completely paralyzed and has the mentality now of a 6-month-old baby. All he was trying to do was make a living, and he just got sideswiped by a helmet that was supposed to be on. You look at that and you think, what a tragic waste. What a horrible way to go, just for something that's so stupid. And that's every day we experience stupidity.
Okay. 2 questions,
Yep.
Michael. What area has the most motorcycle accidents, and what normally hits them?
On the motorcycle accidents, it's equal in all areas. It's obviously less on the expressways where they're not allowed, but the
Yeah,
service roads. My office is in front of the East
yeah,
Service Road
yeah.
in Sucat. We are constantly picking up
Oh man.
motorcycles. One, they're not insured. Two, there's no money, so it's a lose-lose on everyone's count. But there's no other alternative. And this is just one stretch. It's about 2 kilometers
One
from
one
Pikutan to
stretch.
Sucat.
Yeah.
And
Every
it's
day.
every day. So Quezon City, it's even worse. It's anywhere where the rules do not apply or are not enforced. The motorcycles are normally hitting each other and falling over, getting run over by the car behind. The other one are trucks. They just go straight under the wheels. There's been plenty of
Yeah,
those.
yeah,
And then the side swipes.
yeah.
Somebody makes sing it, pushes them out of the way, they go flying into the next car. And unfortunately, mixed into that are the pedestrians who get hit as well.
Yeah.
You know,
Wow. Okay. I mean, this is good to talk about because for people to realize how serious it is. When you first started sharing with me the incidents of heart disease, like every day there's an emergency in my village. You
yeah,
know, how many people are we? That's just in my village, and every day I was like, oh my god. So it really increase my awareness, so I have to make sure that I won't be one of them. But this thing about the motorcycles, I mean, I see it, but it's a much bigger problem than most of us think. No, you see, call centers, trauma. That's a surprise. What kind of trauma happens in a call center?
It's normally to do with the falling to and from work because it's off hours, and drug related.
Okay, okay.
So
Holy moly.
now you're gonna get all the call center people calling me up going, "What the fuck?" Sorry.
No, that's okay. Nobody watches these things. So, yeah,
It's
okay.
yeah.
You were saying you had a wish list for the senators, because here you are saving all of these lives, doing so much good, and yet you're not getting. And you were actually the official emergency medical team for the Pope, President Obama, all the dignitaries, all the lawmakers hire you, but at the same time there's an issue.
There's an EMS bill that's pending in the Senate and has been for many, many, many years. We need to get that EMS bill passed for several reasons, but the top reasons are it recognizes the industry that is recognized worldwide. It allows us to do certain procedures and increase our scope of work on board the ambulances. For instance, in the Philippines, it's only a registered nurse who can insert an IV into a patient. Yet if we're stuck with an EMT on the highway and there happens to be no nurse around, and the only way to control the circulation is to insert an IV line, legally we're breaking the law if we do so. We need that bill passed to increase our scope of work, give us the right of way that we need on the roads. Now I'm for, when it comes to right of way on the roads, for instance, it should go both ways. The assumption is, that the emergency vehicle, fire, police, and ambulance is responding to or has a patient or a person on board. That benefit of the doubt has to be given. But if abused, then the penalties should be thrown back at the police, fire, or ambulances with massive penalties and severity for that action. Otherwise, we lose the credibility.
Yeah.
Here, it seems to be this competition where when ambulance is coming in, you'll either tailgate, which if you're tailgating an ambulance, the patient is staring out the back window. You're disconcerting the patient and the staff behind and causing a higher risk of accident because the driver in front is trying to keep a clear distance from you. For obvious reasons, if he slams on his brakes and you come into the back of it, you're going to hurt the patient and the crew. And the other one are the people who decide to just block. That could be your loved one on board the ambulance, that we're trying to fight to save their lives, and you're just blocking it. When every second and every minute counts, we need this law to be enforced, to be implemented and enforced. There's no right of way in the Philippines for police or fire. There's a law of due regard, which means, yes, okay, let's let them through. But there is no law. It's just the law of due regard.
If you were to give us some tips, right, on what to do. What I do, I see them, I pull aside, slow down, I let them pass. I find that I am more the exception rather than the rule. I see other people try and speed up to, I better go faster so that these guys can also go fast. What's the proper decorum for a guy like me?
Well, in the Philippines, where it's a little trickier because of the road situation, in a country that has the easements on either side, the law is you pull over to the easement and let the EMS vehicles pass. In the Philippines, that's difficult. You're talking about roads like EDSA. There's no easements. Most roads don't have it. It's pull as far left or right as possible.
Yeah.
And let the ambulance work its way through. We know it's difficult, and we know it's in some cases impossible. But with everyone doing the same thing, it will open up that window we need to get through. When we respond in Lifeline to an emergency, it's 2 or 3 units that will respond to that location. So
Oh,
if
wow.
one ambulance is getting blocked, another one is coming from the opposite direction, another one coming from the side. Whoever gets the clear path will get the go to finish off the run. The problem comes is when the ambulance has the patient on board the unit.
Yeah.
That's when we're trying to get to the hospital as fast as possible. Now, given the situation in the Philippines where sometimes it is impossible for you to even give 1 inch either way, and everyone is trying, but it just can't do, that is the importance of having the equipment, medication, and training on board the ambulance.
On board.
Right? The doctors, if they're not on board, which many of them are not required on board an ambulance, it's medical control 24 hours a day with the doctor that is taking control of the emergency happening on board. That's why the DOH finally, when they made the license to operate, require that of everybody using the word ambulance on a vehicle. And if you don't, the penalties are steep and the repercussions are severe. The problem is implementation.
Okay.
How do you enforce it? The police have to be able to do it. The public have to know the difference between what's an ambulance and what's not, because it will make a difference in saving your life.
It's crazy.
If you're having a heart attack and we can't defibrillate you in an incident that can require a defibrillation that will save your life, or inject you with the epinephrine needed to be able to extend your life, what's the point? We're just doing CPR for the next 3 hours to get to the hospital? It makes no sense. But that's where the law it needs to be enforced, implemented and enforced.
Man, what can we do to help make that happen?
Lobby your Congress and Senate.
Yeah. Yeah.
Or unfortunately, Robert, it normally takes somebody prominent's child or family member to die before things like this are implemented. When the fire brigade in the Philippines, about 15 years ago, Lifeline was one of the first in the country to bring in what's called the Jaws of Life.
Mm.
The Jaws of Life is a beautiful contraption that cuts you out of your car wreck. It's not beautiful for you because we're cutting up your car, but it cuts the car around you in an accident and be able for us to take you out safely without causing any more further harm. We were the only ones at the time who had the Jaws of Life in the country because we had a contract with the North Expressway. And it was being deployed on a daily basis. Then I think it was in Forbes Park, there was a fire. And it happened to be Speaker Joe De Venetia's home. It was a Christmas season about 15 years ago. And
I remember that. Dasma. I remember
the Christmas tree burst into flames. The
Yeah.
family ran out the door. The daughter, unfortunately, ran up the stairs. She got trapped. The bullet, from what I understand, the glass was bulletproof, so they couldn't break it. But the bars were so thick that they needed something like the Jaws. We were there, fire brigade was there, police were there, everybody was there watching, and nobody could do anything. And the young girl eventually passed away. We couldn't bring the Jaws of Life from the north. It would have taken us during that Christmas period 4 hours to get it to Dasmariñas. I think within the year after the tragedy, 2 billion pesos went into the fire brigade, for updated equipment, training. Now Jaws of Life are on almost all units of the fire brigade, all because somebody important family member died.
Oh gosh, well, I hope it won't take that. But yeah, man, that's a sad reality.
Well, what's even sadder is that every time we get a new contract, especially in a place that's big, BGC, Rockwell, Ayala, Alabang, Tagaytay Highlands, you name it, it's always a prelude to an accident. There was an accident, somebody died, there was no response, it was inadequate, and that's when they called Lifeline to come in. Make sense?
Yeah, no.
But it's too late. For that person, it's too late.
But with what's happening now, though, is that because you're everywhere, I think it's already an expectation that, like, if somebody puts up a new village, hey, we got to have Lifeline here. You know,
Yeah.
it's like having, okay, we need a dental clinic, we need a regular clinic, and we need Lifeline, we need a contract. And that brings me to the part of momentum. You know, your business from, you know, the startup stage started to become uh, pretty much the standard already. You know, and what happens when you're actually hitting momentum? What changes in your mindset? What changes in how you do your business?
What changed from the first 15 years of Lifeline was survival, right?
Yeah,
Just give the customers what they want, pay the bills, and
yeah,
if we can keep the lights on, the gas on, then we're doing our job, you know. And so, being very customer focused, we retained our members. We have members who have been with us for 25 years. Um, so if you focus on that and keep the core, you can build on that. The last 5 years or so, where we've gone from survival to now expansion, is the perfection of the protocols. You know,
okay,
in EMS, we have to make every possible scenario, and so our protocols are updated, you know, by weekly in some cases, monthly in other cases. So when COVID hit, for instance, we had done so many protocols and exercises in disaster preparedness for earthquake, with the volcanic eruption in Taal, Ondoy, Milenio, you name it. We've always had protocols, disaster protocols in place. The pandemic is a disaster. It's just an unseen enemy, and it's a longer period of time. If the big one came, imagine, Robert, everybody sitting now watching your video who have been
yeah,
on lockdown for 2.5 months. Do the same without electricity, water,
no, no,
or phone or social media,
no,
and you're trapped in because of rubble. So it's not
yeah,
like you're being forced to stay at home. You just can't leave your home because
yeah,
there's destruction. All we did was activate protocols, you know. So we had a 2-day falter in regards to the length of decontamination for such a contagious disease.
yeah,
We had protocols for Ebola, which is basically more fluid. You have to touch it. You don't breathe it. It's not aerosol. But we got the Ebola protocols and we got the SARS protocols that we did in 2002, 2003. You know, combined it up, and within 48 hours, it implemented the COVID protocols that kept the business going. So we never closed the day. We just perfected it within 48 hours.
yeah.
That's the technique now. That's the challenge now.
And thanks for sharing all of those protocols with me and the family, and you know, we shared it with as many people as possible. Okay, quick question: is this a fake virus?
No,
Is it a
no,
fake?
it's a
What
real
do you say to
virus.
all the countries? You see it on a daily basis, right? But it's fake. It's not real.
You know, it's funny. This is not our first time around the block on this. It's just the longest and the hardest. But we had it with SARS. SARS,
Yeah,
they had the same conspiracy theories. It managed to die out very, very quickly, so there was no big impact. Ebola it became MERVs was another one.
yeah,
You know, these are viruses. When they say novel, it's new,
yeah,
which means it comes from, in this case, it's the influenza, SARS, that family, but it's new, so it's novel. Corona, it's a crown. So they've identified what it is. It's just mutated. It's just gotten angry. The theory is, you know, it came from bats. You know, somebody in Wuhan cooked a wild bat, and it spread from there. Um, SARS, birds flu, Spanish flu, all of these things come from usually the wildlife, right? We're getting too close and pushing out their habitat. And the closer we get and the more interactive we become with it, the more novel diseases will come up. But if you look at world history, there's been pandemics. Every 100 years, there's been a major
yeah,
pandemic.
yeah,
It's, call it the world cleansing. You know, it's nothing to be, no need to panic. If it happens, it happens, you know. Everyone has been talking about all of this latest technology with this virus. Wash your hands, keep social distancing, and wear your mask. It's
Yeah.
not difficult. Did the same thing in 1918. They did the same thing in SARS. And we'll get through this one. This one, when we talk about flattening the curve, I think we've gone on too long in regards to the lockdown. The virus, there is no cure for the virus at this stage. A vaccine at best is a year away, right? So this virus is here to stay. In this period of time, the flattening of the curve was to give the opportunity for the healthcare, the hospitals, the doctors, the time in which to be able to adapt to it so it doesn't crash the healthcare system like it did in Spain and New York. And I think the Philippines has done a very good job at that. There are hospital rooms now. There are COVID protocols now. You enter into Makati Medical. There are two. There's the emergency room COVID and there's the emergency room non-COVID. You pass through different corridors. That's not the new normal. That's just protocols being implemented. Obviously, the risk is elderly and the vulnerable, but that's like everything else. Dengue is our biggest killer.
Yeah, I was having a chat with your brother, and he was saying if there's one thing to be worried about, it's dengue. Yeah. It's dengue. How many people die a year from dengue?
Oh, 2 that million? One you have to ask him. It's in the millions.
Yeah.
Look, we live with tuberculosis. We have an X-ray in the clinics with its sole purpose for the occasional broken leg and broken arm in the village. The X-ray is there to pre-screen all of the employees that come in.
Yeah.
Right. And we're screening for tuberculosis.
Yeah.
And that's more deadly, dangerous disease.
Yeah.
And yet we live with it.
Yeah. I actually like the fact that we're all wearing masks and we're all washing our hands and we're all doing social distancing. I think it's a good thing. Something to keep for a while.
I think so. I think it was this instant gratification and this the world was getting too, I guess, global, in my opinion. We could just travel anywhere.
Yeah.
But, even the travel industry, it's going to be hit very hard. But prior to COVID, countries were complaining about too many tourists. We had to shut down Boracay, for Christ's sake, because there were too many people going and ruining the environment. Paris was complaining. Holland was complaining. So they were going to start some form of limiting tourism already, because it was becoming too global. Anybody could access it. There has to be some kind of correction. This happens to be maybe the start of a long correction.
I guess. Well, it's good for the environment at least, no? I mean, the air, the clean air is saving a lot of lives. That's for sure.
You
Absolutely.
Bet. And you know what? Support your country. Instead of going and spending your money, in all of the Disneylands and et cetera, spend it here in the Philippines. We've got 7,200 islands. If every Filipino just went and visited one island a year, our economy would go through the roof.
Nice. Michael, last question.
Sure.
And I'm going to put you on close-up for this. If you have any message for young entrepreneurs, aspiring entrepreneurs, people who are just starting out their business.
Have a vision. Write it down, because if you don't write down your vision and your goal, it's just a dream. So it's important that you write it down. A business plan is adaptable. Don't focus too much on it in the beginning. It's a living, breathing document. It will keep evolving. Believe in what you're doing, and block out the naysayers. If you believe in it, go for it. If you bite off more than you can chew, chew faster.
Too fast.
That's the food and beverage coming out.
Hang on. I pressed the wrong button. That's going to be the title of this video. Chew faster.
Chew faster.
Yeah, Michael. Listen, you're the Dana White of your profession, right? You created the whole industry. It's something that was there for anyone, and you created this whole thing. Congratulations. Thank you for all the lives that you've saved.
Most welcome. Happy to be of service.
Yeah, and I owe you lunch. Thanks for doing this.
My pleasure. Keep safe.
Take care,
stay
buddy.
home. Right.
Stay safe. Yeah, I'm going to stay home. That's why we're. Take care, man.
3 more weeks, we'll know what the 2 or 3 more weeks, we'll know what the impact's going to be.
No, I remember when this whole thing started, man, and I called you. I said, dude, he goes, Rob, stay home. All right, I'll do that.
Yeah, it's
Because you're on
nasty
the
out
front
there.
lines.
Yeah,
Yeah. Yeah, yeah, you said that. It's not good. Okay, I'll stay home. I can do that. I can do that much. Regard to the family and say hi to everyone. Take care,
you
buddy.
too, Robert. Bye bye.
Bye. Bye.